Hi, welcome back. Here we have yet another discussion of an OET replicated case note. So this is a case note which has appeared in the most recent OET exam held on 24th May 2025. So let's get started. Here you can see the case note on screen. The first page, which contains details like patient details, social history, medical history. Then we have a few dates like May to September, the months are given. Then doctor's record is given. Then CN records, community nurse records, like you have different sections of data. And finally you have the writing task. Now during the 5 minutes of reading time, what do we usually do is first we quickly go through the first line of the note to understand what our role is. So here it is given that you are a community health nurse. So the writer is a community health nurse who has visited a patient with chronic lymphedema. So who has visited a patient means probably this has got to be a home visit. Okay, so you understand your role. You are a community health nurse who has visited a patient with chronic lymphedema. Okay, that much is enough from the initial part. Then directly we jump on to the last part, which is the writing task. Now let's read through the writing task very carefully to understand who the reader is and what is the reason for writing. So the writing task says that write a letter to patient's doctor. It says patient's doctor. So immediately as we see patient's doctor, what should come to our mind? That is, it is a known case. Whenever you see this apostrophe S, okay, or this possessive pronoun, it indicates that this possessive pronoun adjacent to the reader's designation, then it indicates that the reader already know the patient. So patient's doctor means immediately we conclude that it is a known case. And then what does the writing task say? Write a letter to the patient's doctor outlining the concerns, further assessment to Ms. Johnson and possible onward referral to lymphedema clinic. So here we understand that we are supposed to write a letter to patient's doctor. What is the reason for writing? The doctor need to further assess the patient. Then you have to outline the concerns. Whatever concerns you have, the writing nurse has regarding the patient should be included in the letter. The concerns should be included. Then you have to request for further assessment. The doctor's further assessment to your patient is necessary, should be requested through the letter. And possible onward referral to lymphedema clinic. Possible onward referral to lymphedema clinic means that initially itself, from the first line itself, we understood that the writer is a nurse who's taking care or who's visiting a patient who has this chronic lymphedema. Now the writing task says that you are requesting the doctor to see whether a onward referral to a lymphedema clinic is needed or not. You're not directly saying, you're not very certainly saying that the patient requires onward referral to lymphedema clinic. Possible onward referral, which means that the doctor needs to assess the patient and it's up to the doctor to decide whether an onward referral is needed or not. And plus the address of the reader is also given. Okay, so from the writing task, now let's see what are the details that we have understood. We understood that the reader is patient's doctor, and for that reason it is a known case. Now why do we differentiate this known case and unknown case? Because if it is a known case, we will not be including the social background and the medical history details in our letter. These should not be included. Not just the past medical history, some recent happenings also, which you understand from the case note that they are known to the reader, should not be included, or rather they should not be repeated in the letter, and you should not be wasting the time of the reader. So whatever details which you feel that the doctor would or the reader would already be knowing, you should not be including if you understand that it is a known case, and in this case it is a known case. Now the first thing that we understood from the writing task is who the reader is. Plus we understood that it is a known case. Then we understand the reason or purpose of writing the letter. So what is the purpose of writing the letter? We need to request the reader to provide further assessment, and it is mentioned here that possible onward referral to lymphedema clinic. So further assessment plus possible or potential management, you can say. So if the doctor is referring this patient to a lymphedema clinic, that is a kind of management from the side of the doctor. So we can generalize it as management. So we understood the reader is, who the reader is, and what the purpose is. Now we go through the case note to understand what all are the relevant details that would be required for this situation. That is the details that would be required by the patient's doctor in order to serve this purpose. Okay, so let's go back to the starting of the case note. Now assume today's date as 7th January 2023. Of course we need that because that is the detail with which we start the letter. Then patient's name, Anna Johnson, Miss Anna Johnson, that is needed. Date of birth, that again is relevant. Address we don't include. Then social history, we know that being a known case it is irrelevant. Then medical history, again past medical history is again irrelevant, so we can completely ignore this being a known case. Then doctor's record. So this doctor's record, the medical practice, this doctor is somebody who is working in a medical practice, and it is to the same doctor we are now about to write the letter. Now the doctor's record, when the patient initially visited the doctor in April 2022, then October 2022, what are the details, what are the major findings have been recorded from the doctor's side. So these details should be included in the letter? No, these details are also known to the doctor, so we should not be including them in the letter. These details are also irrelevant. Now I would say that despite the fact they are irrelevant, there is nothing wrong if you go through these details, because being a writer you need to get a clear picture of the patient's background. It's not for the purpose of including in the letter, but to get a clear picture on what the patient has gone through. You can definitely read through these details during the 5 minutes of reading time, because you have enough and more time. This being a known case, definitely will not need to go deep into the social background and medical history and decide which are necessary and which are not necessary. So of course you can spend time on reading these details to get to know the background of the patient. So from this we can understand that the patient observed skin pitting and swelling on left calf, and the patient was suspected to have stage 1 lymphedema. This D-dimer and DEXA scan turned out to be negative. Then self-management methods were advised to the patient. Then after 6 months the patient came for the review again to the doctor. So during that time the patient still had these persistent symptoms were there. Patient said that she followed the advice. So stage 1 lymphedema was confirmed here. In October 2022, stage 1 lymphedema was confirmed for the patient. So the patient was advised to continue self-management methods and community nurse visits 1 month. So this is the point where the patient is coming over to your care. Now after confirming in October 2022, the doctor confirmed that this patient is having stage 1 lymphedema, and thereafter the patient is being handed over to you, that is the writing nurse, for providing visits from the community health nurse for a month. Now from here on we have to understand that the patient is under our care and the doctor is probably not knowing what is happening with the patient. So here on we have to be careful and decide which all data are to be included in the letter and which are not essential, and some might be semi-relevant. Let's decide. CN records, which means that this is the record maintained by you, the writing nurse. From here on, we have to carefully decide which are relevant and which are irrelevant and which are semi-relevant. December 2022, and you remember, like, the date on which you're writing the letter is January 2023. So this is 1 month prior to that, okay? In December 2022, okay, we have to consider this. Worsened lymphedema, increased swelling, increased discomfort, split skin on upper left calf, some fluid leakage, and you're suspecting stage 2 lymphedema. So should we communicate this detail to the doctor, these details to the doctor? Of course, all of these are relevant. Okay, so we shall put a tick mark. Then sterile non-adherent absorbent dressing applied. So after noticing these symptoms, what did we do? The management that you did as a writing nurse, the community health nurse did was provided this sterile non-adherent absorbent dressing. So that is also relevant, or I would say that this detailing on what kind of dressing was provided, whether should we detail it as non-adherent absorbent dressing, it is understandable to the doctor. So even if you just mention it as dressing was applied, that is also enough. So the details of the type of dressing, I would say it as semi-relevant. Okay, dressing, of course, you have to mention. Dressing was applied, you have to mention, that is relevant. But the details or the type of dressing, it is semi-relevant. Why do I say semi-relevant? I'm not saying it is irrelevant. Semi-relevant means even if you include, you're writing it to a doctor and the doctor can definitely understand that. So if you include that, there is nothing wrong, but it's not really necessary. Now, if you were writing this letter to a social worker, then detailing the type of dressing, then there it would be irrelevant, because the social worker is somebody who's not having a very in-depth medical knowledge, just like a doctor. So you should not be getting into the details or the technicalities of the dressing. You can just say that dressing was applied. But here, this reader being a doctor, you can mention it, or even if you exclude it, it's going to be fine. Now, the next is patient advised to continue leg elevation exercise, cleansing, moisturizing routine. Okay, that was another management. The advice that you gave to the patient, that is also relevant. Paracetamol 1 gram 6 hourly, that was also prescribed. So that also is relevant. Community visits twice per week. So earlier it was mentioned that once every month the community health nurse needs to visit the patient. Now, after noticing this worsening of lymphedema, the frequency of the visits have been increased now twice a week. Okay, so but this, even if you don't say to the reader, it is okay, fine, because here we don't have any other extra dates. One we have in December 2022 and the next date is today, the day on which you're writing the letter. So that's fine. So this would not be relevant. You just have to outline the patient's condition. Okay, that is the main or the central idea should be that. So from December 22, you're detailing how the patient's condition was, Ms. Anna Johnson's condition was, and what management you gave, what suggestions and what advice you gave. All of this would be included. Okay. Now moving on to the next date, 7th Jan 2023. This is today, the day on which you're writing the letter. So what is the progress? Dressing applied. Okay, you provided redressing. That is relevant. Symptoms unchanged. So symptoms are persistent, and on top of that, some hardening and blistering of skin also you have noticed. So that is also relevant. Dressing regime still appropriate. It is same as this. So this two you can combine and put it as one. That is, you provided dressing. That is enough. Do not repeat the details. So regarding the symptoms are persistent, plus some new developments, hardening and blistering of skin you noticed, plus then you provided the dressing. Then again, you are suspecting stage 2 lymphedema. So that is relevant. Here also you suspect the same. Make sure that you don't repeat the details in December and again in 7th January. No. Then patient reported, followed the advice. So you are making it clear. That is also relevant. That is, you have to make it clear to the reader that despite the compliance with the management or the suggestions given, still the patient is experiencing worsening of the symptoms. So that is also necessary. Then the discussion you had with the patient. Low mood, episodic tearfulness reported, negative impact of lymphedema on daily life. So these were the concerns raised by the patient during the discussion with you. That is, she is experiencing low mood, like then she has episodic tearfulness, and then she has this concern that this condition, this lymphedema has a negative impact on her day-to-day life. So now regarding this, like students had a concern regarding this point, whether it is relevant or irrelevant or semi-relevant, this discussion, the details of this discussion. Now, usually we see that during discussion, when the patient experiences low mood or the patient is going through an emotional distress, definitely in the plan, there would be something related to the management of that emotional part, probably referral to a psychologist or maybe some sort of counseling. But here if you look at the writing task, nothing related to that emotional aspect has been mentioned. So students had this doubt, should we be including this detail regarding emotional distress and low mood in the letter? So what is your take on that? Should we be including that or not? Now, if you go through this writing task, here it is said that write a letter to the patient's doctor outlining the concerns. See, did you notice? Outlining the concerns. So, of course, this being being somebody who is currently taking care of the patient, it is your concern to pass on the problems or the situation that your patient is right now going through to the patient's doctor. That is the patient's doctor who has been taking care of this patient before handing over to you. So definitely you have to update what all are going through, what all the patient is going through as of now, so as the patient can receive a management in a holistic manner. Okay. So I would say that from that perspective, this detail is of course relevant, no doubt regarding that. Then the patient recommended appointment. So we recommended that the patient can have an appointment with the doctor and will take themselves, means the patient agreed that okay, I'll go for the appointment by herself. Then possible possible onward referral to lymphedema clinic was also discussed with the patient, and the patient agreed to that. Like so, during the discussion with the patient, you understood that the patient has been compliant with the management regime, but still the condition has been worsening. And you had a discussion with the patient during which the patient also expressed that she is experiencing low mood, then episodic tearfulness, and she is concerned regarding the negative impact this condition has on her daily life. So all of these are relevant, and you're going to update all of this to the patient's doctor. Okay, now we have in hand which all are the relevant details, which are the semi-relevant details, and which are the irrelevant details. Now that we have decided, so whenever you do your writing, I have mentioned it across all my videos that writing is not just about transforming the note forms into sentences. No, that is just one part of writing. The first step when it comes to writing is identifying the purpose. So here we understand that the reason for writing this letter is to update the current health condition of the reader's patient, Miss Anna Johnson, who is suspected to have stage 2 lymphedema. Okay. And what is the requirement, what the reader has to do for the patient is further assessment and management. Okay, so this is the first step of writing. We need to understand what is the reason for writing the letter. Then the second step is data selection. Based on the purpose, you have to select the relevant data. You have to categorize the details as relevant, irrelevant, and semi-relevant. That we have done now. Then the third step is organization. We need to plan how the paragraphs should appear. The paragraphing should be decided. Should we start with the medical history? Should we start with the social background or the recent happenings? That is what we are going to decide in organization. Now, this being a known case, we don't have any such confusion because we are very sure that medical history and social background details are not to be included in the letter. So, definitely, how will the structure be after the purpose? We would be writing the details of December. Then, we'll be writing the details of today. And then, finally, we'll be closing up with the recommendation. Okay, so here there is no confusion regarding the organization, purpose, then the details of this December 22, then details of today, and finally the recommendation paragraph. Now we have decided on this also, and then we will get into our writing. That is transforming the notes into grammatically right sentences. I'll show you, based on that, I'll show you a sample letter. You can go through. Okay. Now this, why have this included this writing task in this page on the screen is also because whenever we do our writing, right from the purpose up to the recommendation, everything should be aligned to this writing task. Okay, central idea should not get deviated from this writing task. So always keep that in mind. Instead of keeping that in mind, I've kept this on the side of the screen so that you can always relate to whenever you go through every sentence or every paragraph in the letter, you have to connect it or tag it with the writing task. The purpose goes like this. I'm writing to update you on Miss Anna Johnson's current condition and to request your assessment along with consideration of potential management as stage 2 lymphedema is suspected. Now here I've used potential management because like if needed, the patient should be referred to a lymphedema clinic. It's not sure. So that's why I've included this word potential management. I don't say that it's necessary that you include the word potential. Even if you say it as simply management, that is also fine. You can simply put it as request your assessment along with further management as stage 2 lymphedema is suspected. Now moving on to the first expansion paragraph. During the review in December 2022, you have put that as the introductory phrase to give the timeline, to give a picture of the timeline to the reader. Ms. Johnson presented with worsening symptoms of lymphedema. She was noted to have increased swelling, discomfort along with skin breakdown and fluid leakage on the upper left calf, for which sterile non-absorbent dressings were applied. This, even if you don't mention it, that is also fine. Then she was also advised, the advice given, continue leg elevation exercise along with cleansing and moisturizing routine. Then paracetamol, that also was recommended. All of this included in the first expansion paragraph. Then in the next paragraph regarding today's visit. In today's follow-up, Ms. Johnson's symptoms remain persistent. So in the first sentence itself, we are making it clear to the reader that there is no improvement in the patient's condition. Notably, now you're talking about this new development. The symptoms are still persistent, but notably something else has also developed, that is skin hardening and blistering, though she reported adherence to the advised care regimen. See, like how connectors have been used. That is also important. How do you use complex connectors to develop complex compound sentences? So here you are trying to connect the idea that like new developments have happened despite the fact that the patient has reported that she is compliant or adherent to the care regimen. Then a dressing was reapplied to the affected area. However, like even though we provided the management, however, again a connector, she appeared emotionally distressed. We are now talking about the emotional part, and reported occasional tearfulness, expressing concern about the impact of her symptoms on daily life. How the symptoms of this lymphedema is affecting her daily life. Okay, so with that we concluded the second expansion paragraph. And finally moving on to the recommendation paragraph. It's simple because we don't have a separate plan as such in the case notes. So with the minimal details that we have in the writing task, again we have to rephrase the idea what we have written in the purpose paragraph to develop the recommendation paragraph. How can we do that? Ms. Johnson would benefit from your further assessment and consideration for referral to a lymphedema clinic. So here also you have to be careful. Sometimes students might write that she requires referral to lymphedema clinic. Can you write like that? No, because it's not certain. Obviously, it is given in the writing task possible, and even in the case note, a question mark has been mentioned before this onward referral to lymphedema clinic, which means that it's up to the doctor to assess and decide whether a possible onward referral is needed or not. So definitely you have to mention that some words like consider the need for a referral to a lymphedema clinic, or she may require a referral to onward lymphedema clinic. Please don't write it as she requires referral to lymphedema clinic. It changes the meaning, which means that under the assessment criterion, which assessment criterion? Content assessment criterion. In content assessment criterion, it is said that you should be including all the key information plus the accuracy of the content. Of course, you can paraphrase the details, but the meaning should be kept intact. Now, while transforming this case note into sentence, instead of may require, if you put it as require, then you have changed the meaning of the content. Okay? So, be careful when you transform the note forms into sentences. So with that, we come to the end of this discussion. So hope you found this video helpful. We'll be back with more such replicated case notes. So stay tuned. Thank you.
Medcity International Academy. Trusted hands forever.